Hi, my name is Dr. Spencer Zimmerman. Have you heard of this therapy for depression? It's used for both treatment-resistant depression, but I also have many patients who use it because, well, frankly, they don't want to be on a lot of medications for their depression. So this therapy is called transcranial magnetic stimulation. It's really become popular over the past 10 to 20 years. It's been around a lot longer than that, but now you're really seeing it pop up a lot more. And one of the questions that an inquisitive mind is always going to ask is, can we do something better than we did it in the past? Now, I'm going to review some research with you to suggest that is true. So I'm going to share my screen and we're going to go to that research. So the traditional therapy for transcranial magnetic stimulation has been you go into an office and you receive daily treatments over a 6-week period, followed by typically another 2 to 3 weeks, which you are phasing down. And so instead of getting 5 treatments a week, you now get 2 or 3 a week. And then if you saw some improvement, you would get it again in 6 months. It's typically what would happen with cycles. But there's a lot of requirements to get that treatment, especially if you want your insurance to cover it. And this is the only treatment insurance covers at this point in time. The other ones they don't cover, despite the research being abundantly clear that they should. But that also means with this other treatment, it is more cost effective. And I'll explain that in a moment. But the regular treatment, once again, it's done daily over 6 weeks, followed by some tapering off. It is 30 to 45 minutes, depending on the unit you are using. But in order to qualify for it from an insurance perspective, you must have tried and failed different medications for depression. So like a Zoloft, citalopram, citalopram, Cymbalta, duloxetine, and others. It's not just one medication. And depending on the insurance company you have, it can be 3, 4 or so medications from different classes. So one of the treatments is using what's called theta burst stimulation. So we said treatment can be 30 to 45 minutes, depending on the unit. Theta burst stimulation actually does the same part of the brain, which is right here at your left dorsolateral prefrontal cortex, but it can do treatment in 3 minutes. Yes, once again, 3 minutes. So this is a newer form. Now, this was when it was out. So this research was in 2018. So 3 minutes versus 37.5 minutes. And they said, okay, how does it compare? Is it effective? Is it safe? And how do people tolerate it? Well, I can tell you from people who've done the other one and then came into my office and did the shorter one, they tolerated it a lot better because, let's face it, a magnet applied here that's rapidly pulsing is much more comfortable over a 3-minute period, especially when it's not pulsing for at least half of those 3 minutes versus a 37-minute one. And so the way that they did here was they call it non-inferior. That's the way they were looking at it is, are we going to get at least the same results? And the answer is yes. Both treatments had low number of dropouts and similar side effects, safety, and tolerability. But remember, it doesn't take you as long. So that makes it more cost effective. You can deliver the treatment at a lower price point. And that's one of the things we are able to do for our patients because of how we run it. Now, we typically also do another side, which we see works really well. Now, there's really new research. So this is September 21st, 2022. And they looked at standard treatment, which is once again, the left side for 37.5 minutes, but they also added the right side and they did it for 10 minutes. We also have the right side, but we do it a little bit differently than they did it here. But they compared it to 3 minutes on the left, followed by 47 seconds on the right. Depending on the unit, it can't always be done in 47 seconds, but it can be done in under a minute. And what they found was, when you look at this, right, they did this in ages 60 to 74. And guess what? Overall, their primary endpoint was no different. Okay. At 4 weeks, it actually had better effectiveness post-treatment compared to the other one. But then as it went out a little bit longer, you ultimately ended up in the same place. So what's the takeaway of this? Well, in older adults with treatment-resistant depression, bilateral theta burst stimulation compared with standard bilateral RTMS achieved non-inferior or reduction in depression symptoms. So once again, Using theta burst stimulation rather than RTMS could increase access to treatment several fold for older adults with treatment-resistant depression. Now, that is what we do here is we help patients get treatments without having so many barriers, not making you go through so many different medications, because not everyone wants to be on the medications, and it's your body, it's your choice to choose. Also, we allow you to pick the right approach for you. That means we can deliver treatments faster. If we only need the left side or we need to go bilateral and using this combination, we take it. But most importantly is we take the research as it comes out. Insurance only changes when research has done so many times. It's like, well, yeah, we've known that for about 20 years now. It's cool that you finally want to cover it for those people. But for those that don't want to suffer and wait 20 years, we're bringing you the latest research when it comes out, and we start applying it in clinical practice, which helps people not to suffer and not have to wait as long to get better. So what did you learn about this, right? Did you know this about theta burst stimulation? Did you know this about transcranial magnetic stimulation? Or maybe this is your very first time to learn about transcranial magnetic stimulation. But either way, I hope you found this information useful. Transcranial magnetic stimulation is one of the biggest tools that we have out there for treatment-resistant depression, or for those that don't want to be on medications. Beyond that, in the research, though, transcranial magnetic stimulation does show a lot of promise with anxiety, insomnia, PTSD, OCD. It's even being used in stroke rehab and many other things. So don't limit it, because ultimately, if you can get the brain to connect at a better rate, you can improve functionality in a lot of things. And over the years, we're going to see bigger and bigger studies, and hopefully it becomes more widely accepted. But until that point in time, we will always be one of the clinics that is striving to be at the forefront and take the research when it comes out. So there shouldn't be a massive delay between research and clinical implementation. Unfortunately, there is in most aspects of medicine. But that is our promise, is that we are always learning so you can get the solutions you need without having to wait as long. So yeah, comment, let me know. What did you learn? Have you found this information useful? And if you'd like to work with us, here's how you can do it. And that's going to be in the comments below.